So, good afternoon. Time is 3:44 and the date is 17/4/20. So, I have taken this Manual of Clinical Surgery by S. Das, and which includes special investigations, differential diagnosis, and so surgery was fourth year. During the year 2013 August, 2013 October. So August fully was exam and September was practical. So 2013 uh, October to 2014 August, right? And so 2014 was our end date given. August was our final year ending, and from 14 to 15, like after that, I mean, no. This is from 2013 up to so we had 5.5 years of time, and so 2009 was the beginning, and 2010 we had the first year completion on August. 2011 we had the second year completely, and 2012 February we completed the second year, and 2013 and the third year completed. Then from March, so February entirely we had exams, and so on March first week we had this practical exams and all, actually like that. And so like yeah, and January we did not have exams. Only February 1st we had, and late till March we had March 1 we had exams, I think. So February first half we have the theory, and the second half we had the practicals. And so like um, and so like 2014 Feb. So 2013, 2012 was our second year, 13 was the third year, and 14 we finished the final year. But till the August 14, I had to learn the subjects of final year, and so I have to make sure. So like OG and subjects, Ali ma'am was there. I have to make sure that whether you are agreed for it or you have allowed it with some negotiations, like with someone's request. So in Britain, we don't allow that. Just because, like, I am not on power, you can't say my mother is not on power, or a Batten's wife is not on power. Consider Indira Gandhi. So both of them are of respectable age. They are on power, and also you see, this Queen Mary is on power still. She has not retired yet. Only the previous queen has been retired. So her mother-in-law. And so Queen Mary is still on power. On the maximum power is Queen Mary. So we must respect all of the vows and all of the proceedings. So who have given you permission? Don't say Mountbatten has done that and this and all. Prince Phillips has done that and this and all. Um, but okay, if you have extended on the means of a climate or a satellite or some space extension, it's okay. You could have done it. You have done it up to only August of 2014. Then 2015 was there completely, but I did not go for most of the classes. But also we paid the amount of 2 lakhs for the entire community. And next 6 months we did not go. Only for about 1 year of time, we just not even we attended for 6 months, less than maybe like 4 months we were there in the college. The remaining time we were in the home only. So I donate this amount on the East India Company Trust to the homes of the all of the people. This is the money of the people, so we won't have it with ourselves. That can be used for any other expenditures, except of making a surgery or some uh, like. Um, uh, Corona fund. We are not donating it for that. We'll be having it for household things. Maybe we'll have it for the women fund, because women are not there. We'll have it for the women fund. So it is like about some 4 lakhs into 100 people. So it is 400 lakhs, about some 4 crores. So that will be donated for the women's fund. So, and as usual, so this won't be directly funded transferred. This will be taken sign from all of the people, whether they have met any of the women nearby, any of the girls who are in need. So this is to bring about the data on all of the girl children's born who are of 0 to 14 years of age, and of their education needs and fund, since they have not been on the study mode. And that's all about it. And my batch had culturals in 2015. So my batch departed. So actually it's my late batch. I had a previous batch also. And so this is the 2009 batch, and it departed by 2015. And so like um, actually, yeah, so they had their culturals by 2014. And thanks for everything. And next, 2016 March only we were given completion. So, the people responsible for this, people are there. So, are you mentioned about these things earlier, or you have mentioned only in an incident to make a break? So make sure about it. If you are made to an incident, then it is a punishable act of crime, and you can report to us as early as possible and get the necessary funds because of your loss, because lot of them have invested in their own money. And so next, uh, Surgery is like we had a general scheme of case taking. So we have a history taking, and we have particulars of the patient, and the name, age, and sex, and religion, and social status, occupation, residence, chief complaints, history of present illness, and past history, and drug history. And so you have history of allergy and catastrophes, and personal history, family history, history of immunization, and all of the things. And you have the physical examination. So you have the general survey, general assessment of illness, mental state, intelligence, and built-in state of nutrition, and attitude, gait, faces, decubitus, color of the skin, the pallor, the cyanosis, and central cyanosis, and jaundice, and skin eruption, macros, pustules, and pulse, respiration, temperature, local examination, and general examination. And so, for the diagnosis and the differential diagnosis, for selecting the type of anesthetic, to determine the nature of operation, to determine the prognosis, the head and neck, cranial nerves, eyes, mouth, and pharynx, and movement of neck, neck veins, lymph nodes of neck and upper limb. So then we have the thorax, abdomen, lower limb, examination of the external genitalia. Then you have the provisional diagnosis, special investigations, clinical diagnosis, and treatment, progress, follow up, and termination. So then you have a few special symptoms and signs. So you have the superficial pain, segmental pain, deep pain, psychogenic pain, and original site of pain, origin and mode of onset, severity, nature of the pain. So whether it is vague aching pain, burning pain, throbbing pain, scalding pain, pins and needle sensation, shooting pain, stabbing pain, constricting pain, distension, and colic, and twisting pain, and just a pain. And you have progression of the pain, duration of pain, moments of pain, radiation of pain, referred pain, shifting or migration of pain, special times of occurrence, periodicity of the pain, precipitating or aggravating factors, relieving factors, associate symptoms, and conclusion. So then you have topics on vomiting, itching, hiccup, um, and abnormal superficial veins, tongue, nails, spitting on pressure, crepitus, faces, and examination of a lump or a swelling is given. So, on the third chapter, so let me deal with the first two chapters first, because I could explain my what we have done in the surgical department during the year 2000. So, um, 2013 to 14 Feb was our surgical period, but surgery period, but um, we had classes in between in the first year itself, because in the morning we had all of the departmental classes, and so evening we had only the third year subjects. And surgery in was extended up to the theory classes was extended up to August of 2014. So we had about 1.5 year of surgery classes again. um, and so like and we had confusions with the whether to because we have failed in ophthalmology, whether to attend ophthalmology or the surgery. So whether to attend the third year classes or fourth year classes, we were not directed about which class to attend. Don't say we have ragged on you or we have misbehaved or we have not followed your rules. It's your duty to make things clear. You can't maintain just blah and blah. So it must be a proper thing and proper maintenance. A single person, say a dean or a DMS, cannot maintain the whole batch without an announcement or all of the things. If you want money, you can make it 1,000 times in better way. This is not the place to make it, and so this is my advice, and so so then we have examination of a lump or a swelling. So if you are learning along with this, then you have to make sure other person who a learned person has all of the charts, and so then we have the examination of ulcer and all. So surgery, to say, like from the exterior, from the outer side, it was very easier, like when we had seen the cases, it was very easier, like, but you must have truly stated, the examiner must have truly stated that please listen to the examinations, the practical part, and try to write it in the theory part. So we had both practicals and theory. So we were not in a mood to write all of the things from the taken from the practicals, because we had separate examination of practicals which was made very tough by the examiners, and so then we have a lot of things. Okay, let me continue with the examination of a lump or a swelling and go by sequence. So, we'll see about the examination of a lump or a swelling. Swelling means it is a bulge which is caused due to muscle injury, and lump, it is a bulb or a bulge um, which is caused by underlying fat or interstitial fluids, and so a lump is a vague mass of body tissue, and a swelling is a vague term which denotes an enlargement or protuberance in the body, and so, due to any cause. According to the cause, a swelling may be congenital, traumatic, inflammatory, neoplastic, miscellaneous. So, then we have tumor or neoplasm is a growth of new cells which proliferate independent of the need of the body, while benign tumor proliferates slowly with little evidence of mitosis and invasiveness to the surrounding tissue. Malignant tumor proliferates fast with invasiveness and mitosis. So, mitosis is the main cause of these tumors. So, mitotic divisions and meiotic division, and so the vertical and horizontal divisions, and so the history. So, the duration, how long is the lump? So, example is cystic hygroma and meningocele. And so, keloids have developed in the scar of vaccination and ear picks. So, there's a diagram given. So, on seeing these diagrams, I remember about my Bailey and Love book. So, it's a book of my father, and when he did his uh, diploma in medical sciences in Hyderabad. So, these pictures are similar of the old pictures. So this is a nice picture taken by the satellite or an x-ray machine. So it's not a normal photographic, so it's an old photographic method. And so with exposure to light and um, so like and some paintings along with it. And or in a dark area with light exposure, to say only with the so you can't go to space and do it, but in a dark area you could do it. Most of the cinematic cameras are like this. And so this is the root of the present space cameras which I use. And so this is sacrococcygeal teratoma, usually present since birth. Rudimentary hand is seen in the tumor which develops from the totipotent cells. And so it's a teratoma a diagram given, and it's present since birth, and in the sacrum and the coccyx area. And so rudimentary hand, so a hand is seen in the tumor. So it's a totipotent cell development. Usually, these kind of cases are like during pregnancy itself, it develops when a child borns, it's born with that. But it disappears in certain stages, but it reappears when during the pubertal age or some developmental age. And next, we have this um, lumps, mostly inflammatory and neoplastic, and we have mode of onset. So, mm, gradually increase in size, which is a neoplasm, and from it occurs from pre-existing condition, that is a keloid. And so which may start from a scar or a burn, and or even from a pinprick in the ear. So, and other symptoms associated with lump. And pain is the main symptom. So in case of traumatic and inflammatory swellings, and the nature of the pain, the site, the time of onset, and the progress of swelling, and the exact size and site and fever. So like in case of abscesses, so there is a sepsis and there's a fever. And axillary abscess, gluteal abscess, ischiorectal abscess, and pyogenic lymphadenitis, often associated with fever, and sometimes Hodgkin's disease and renal carcinoma. So then it's the presence of other lumps. So that is neurofibromatosis, diaphyseal achalasia. And it shows multiple lymphoglandular enlargements. And we have the secondary changes. In between, I would like to remind you that I'm not taking class here. I'm just reporting things, and please don't follow. And um, then we have this secondary changes and impairment of function. And for example, in osteosarcoma and cold abscess, and there is recurrence of swelling, that is in the Paget's recurrent fibroid and cystic swelling. if the cyst wall is not completely removed, and we have loss of body weight and past history with generalized tuberculosis and past history and personal history. So we have this chuta cancer of hard palate seen in women who smoke cigars with the burning ends in their mouth. And kidney cancer occurs due to mixture of lime and tobacco kept in the gingivo-labial sulcus. So like a bida or something like that. And lime and tobacco. And so a pan and family history. So tuberculosis, von Recklinghausen's disease, and many malignant tumors. And we have the physical examination. So you would have heard about these names repeatedly, and so I thought I could memorize that and write it in the exam paper directly. So that's the thing which I did for poor communication. So the Salem Department Corporation is announcing. So the physical examination, a case of sacrococcygeal teratoma. So a teratoma, and usually teratomas are bigger in size, and in a child it is there. So then a case of keloid in its typical position over the chest wall following a small abscess. And so next person, it shows a typical site of dermoid cyst at the outer canthus of the eye. So the canthus. And so general survey. Um, the cachexia or malnutrition may be obvious in the first look. And so osteosarcoma, uh, that is pressing on the nerve, swelling present, and local examination, inspection, the situation, and so like dermoid cysts are seen in the midline of the body or on line of fusion of embryonic processes. That is at the outer canthus of the eye. That means on the line of fusion between the frontonasal process and the maxillary process. So, or behind the ear, that is the post-auricular dermoid, and on the line of fusion of the mesodermal hillocks, which form the pinna of the ear, that is the outer ear. And so next we have the color. So we have the black color of the benign nevus and melanoma, red or purple color of hemangioma, and we have the bluish color of granula, and the shape um, of the swelling must be noted, and size. The we might miss the deeper dimensions, and so then we have the surface, and example is cauliflower surface of squamous cell carcinoma. And so you see the picture with the head backside a cauliflower shaped SCC, and we have a papilloma in the armpit, and so irregular numerous branched surface are seen, and edge. So has a nice description. Surgery itself has a nice languagistic description. So we have the edge. uh, Swelling may be pedunculated or sessile. They may be present with a peduncle, that is a stalk, or it may be sessile, freely hanging. And number, and they are always multiple. So I'm sweating a lot, and so these edges, numbers, color, shape, and size was very good to hear in the early stages in the second year itself. So, like only in the evenings we had the laboratory, and in the mornings we had in the we had been in the department of surgery, and from the second year I think. So we have these things said. So most of the things were like introduced by the seniors, and so like the color, shape, size, and all. So they were very much teaching us, and so like the numbers, diaphyseal atlasia, neurofibromatosis, multiple glandular swelling, and some swellings are more known to be solitary lipoma, dermoid cyst. Then, so it's sweating a lot here, and so like and we have this pulsations. So like swelling arise from the arteries, pulsatile aneurysm, and vascular growth such as carotid body tumor. Um, that is an aneurysm. It is a pulsatile swelling, so it has a pulse along associated with the swelling. So if you touch the swelling, or if you hear with the stethoscope, you could hear the pulse. And then and the vascular growths, that is carotid body tumor, and so then this pulsation is called transmitted pulsation. That is the swelling which lies just superficial to the artery in close relation to it will be pulsatile. That is the transmitted pulsation. And whereas those which arise from the arterial walls itself, that give rise to expansile pulsation. So transmitted and expansile. So expansile is that it has some expanding properties, and similar to the artery. Movement with respiration, and certain swelling arise from upper abdominal viscera move with respiration. That is those arising from liver, spleen, stomach, gallbladder, hepatic, splenic fractures of the transverse colon. So these swellings arise from the upper abdominal viscera, and so then you have impulse on coughing, and which are in continuity with the abdominal cavity, the pleural cavity, the spinal canal, and the cranial cavity. So then you have movement on deglutition, and so so like you have four cavities as usual, and you have movement on swallowing, that is which are fixed to the larynx and the trachea, move during deglutition, that is the thyroid swelling, the thyroglossal cyst, subhyoid bursitis, and pre or paratracheal lymph node enlargement. It is a subhyoid bursitis below the hyoid, and you have the before are an attachment to the tracheal lymph node enlargement. So the pre or paratracheal lymph node enlargement. Then you have movement with protrusion of the tongue. So and so it's like thyroglossal cyst moves up along with the protrusion of the tongue, showing its intimate relation with the thyroglossal tract. Then, so as you move the tongue, the cyst also moves, and skin over the swelling. So, red and edematous swelling is an inflammatory one, and the skin becomes tense, glossy with venous prominence. Swelling is a sarcoma with rapid growth, and the presence of a black punctum over the cutaneous swelling indicates sebaceous cyst. So, skin becomes very dense, glossy with venous prominence, with veins prominent and glossy. So, swelling is a sarcoma, and so plaque punctum over the cutaneous swelling indicates sebaceous cyst. So like a black mole or a mark there, so like a punctum, there is a joint mole, or something like a bigger skin development, so to say thrust of skin. And actually this my cat was shaved completely, and he came yesterday, and he is supporting my surgery by having so he came with a black punctum in his nose. And so just now, as by reading, I was asking him, why are you having this, where did you go and fall? And so I think he is supporting surgery. And so then pigmentation of skin is seen in moles and nevi, and after repeated exposure to the x-rays. So then you have presence of scar, and so you have this pseudo orange appearance, and in the breast carcinoma, and so and you have any pressure effect, uh, and so like any pressure effect, that is um, it's always essential to conclude the inspection by examining the limb distal to the swelling, and this will suggest as to what may be the diagnosis. And axillary swelling with edema of the upper limb means the swelling is probably arising from the lymph nodes, and wasting of the distal limb indicates the swelling to be a traumatic one, and the wasting is due to either non-use of the limb or due to injury in the nerves. Sometimes the swelling may be seen in neck with venous engorgement, and this should immediately give rise to suspicion of possibility of retrosternal prolongation of swelling, giving rise to venous obstruction. So then you have palpation, and so the due to reckless handling, so it must not hurt the patient. And temperature, so rise due to excessive vascularity, and it may be due to vascularized tumor, that is the sarcoma. And you have temperature of swelling is being felt by the back of the fingers, and then you have tenderness, and there is patient's facial expression uh, to see about, and inflammatory swellings are mostly tender. So temperature is okay. This tenderness is that it's a sign. And so pain during exertion of pressure over the affected area. And so like neoplastic swellings are non-tender, and inflammatory swellings are tender. And so size, shape, and extent, and the surface, and that is smooth, it is a cyst, and lobular with smooth bumps, it is a lipoma, and nodular, a mass of matted lymph nodes, or irregular or rough, that is a carcinoma. So these things are there. So if it is very smooth, it is a cyst. So it has this cyst has only a thin outer covering of skin, and usually in deeper skins, harder skins like the abdominal wall is very hard, so there you can't see most of the cysts. And lobular with smooth bumps, there is a lipoma. Lipoma is usually lobular and with smooth bumps. Lobular means has different lobes, and smooth, which has smooth bumps. Usually in lipoma also the skin is uh, very thin, and nodular. There is a mass of matted lymph nodes. So nodular means like with a lot of nodules so like a bump and a nodule usually is a bump is a enlarged spherical surface, a nodule is a circular surface, and so a mass of matted lymph node, so like lymph nodes together. Especially we saw lymph nodes in the armpit, and in the um, actually the jugular lymph nodes, right? And nearby the armpit, and so and lymph nodes nearby in the this nearby the abdominal hip region, or and so and or irregular and rough, so which is irregular, so there's a rise and fall, and different skin, when you touch the skin, and consistencies, and which are very rough. The skin doesn't have the elasticity, and doesn't have the shininess on the outer surface, because the vitamin D is absorbed by the carcinoma and the cells, and and edge. So so these edges are very important in cases of ulcer, and benign growths, smooth margins, and malignant growths, irregular margins, well defined margins. So, and shows how to feel the margin of the swelling. The margin of cyst yields to the palpating finger and does not slip away. That is lipoma. So, um and then you have the consistency. So, like consistency is that a uniform consistency. Um, uh, and it may be soft, that is lipoma, cystic, cysts and chronic abscesses, firm and fibroma, hard but yielding, chondroma, bony, hard, and osteoma or stony, hard, and carcinoma. So, like, and um, so You also have gaseous swelling, gas gangrene, surgical emphysema, crepitus may be heard. So, like a soft consistency is lipoma, very soft, and cystic is cysts and chronic abscess. So, cystic consistency is that a breakable consistency like a glass, and so then you have a firm consistency, so firm like a meat. So that is fibroma, hard but yielding. So it's very hard, but it is yielding. Is that it is giving way to our fingers through movements, and so that is a chondroma. And bony hard is that it doesn't even move, it is stuck to the bone and doesn't move. So example is hard consistency is attached to a muscle, bony hard is attached to a bone, and so it is osteoma, or and stony hard, it's very stone, it looks like a stone and it's of weight, and example is carcinoma. So and so like um, and so you have the slip sign. So when the edge of the swelling is palpated, the margin of a solid swelling does not yield to the palpating finger but slips away from it. But in case of cystic swelling, the edge yields the pressure of palpating finger and does not slip away. And so you have correct method of eliciting fluctuation. So the fingers of the hand will remain passive and perceive the movements of fluid displaced by the fingers of the hand D. So like you must make one hand stable and one hand movable, and so, variable consistency. Variable consistency, like for example, um carcinoma or sarcoma, which indicates malignancy, and so, when a content is pultaceous or putty-like material, swelling must be sebaceous cyst or a dermoid cyst, or even an abdominal colic swelling containing fecal matter. So, fecal mass. Sometimes the swelling pits on pressure. So, then you have fluctuation. So I think this examination of a lump or swelling is going on, but it is of a short case, and then you have different pathologies depicted, and then you have examinations of a ulcer and sinus or a fistula. So so very much sweating on, and it's like someone pouring water from the heaven. So the Agasa Ganga has started flowing by now, and they have started the crane, and so like a pultaceous or a putty like a material, and so yeah, coming to it. So this putty like material, and so especially the plague, the bubonic plague, which is a greatest issue of COVID 20, and so which prevents us from enjoying the benefits of the new year, and so and so usually like this pultaceous material are found in the lining the intestinal wall, causing a plaque, and and so fluctuation, and so there is a test performed in two planes at right angles to each other. So, example, quadriceps femoris. Um, so so there's a diagram given. There is implantation dermoid at the dorsum of the left hand near the web between the index and the middle finger, and so this fluctuation tests and all of things, and method of eliciting fluctuations, and especially the zooming in and zooming out in a mobile phone, in a smartphone, touch phone, you could easily manipulate the fluctuation method is given. So very nice about it, and so hmm, and so the Paget's disease. I mean the Paget's test. So always with the so, and in case of hydrocele, which is freely movable and all of the things, and so the watching fingers, and testing for translucency, and with the X-ray sheet, and fluid thrill, and and impulse on coughing in case of an adult and a child, and translucency uh, first container clear fluid, and it contains opaque fluid such as blood or pultaceous material. It won't be visible. It is dermoid or a sebaceous cyst, and so then you have impulse on coughing, and there is there's a lot of noise outside. Let me check out and come. So all that spoils of the war, and so testing for compressibility in case of hemangioma of the upper lid. So they are testing for compressibility, and so these are some reddish growth, and so those which are in continuity with the abdominal cavity, and with the pleural cavity, that is empyema necessitans, necessitatis, and which are continuity with the spinal canal or the cranial cavity, that is spinal or cranial meningocele, and we have the reducibility, that is swelling reduces and ultimately disappears when it is pressed upon, and the feature of hernia. So usually in hernia, when there is contents inside the sac, when on pressing back they disappear and they reduce. So that is lymph, varix, varicocele, saphenavaryx, meningocele, all are the reducible partly or completely. Certain swellings reduce half of the size, and certain swellings completely reduce. And next you have compressibility. Compressibility means the swelling may be compressed, but would not be disappeared completely. They have connections with the abdominal, pleural, spinal, and the cranial cavity. So they are liquid filled and are mostly of vascular malformations. That is um, arterial, capillary, or venous hemangiomas, and you have this lymphangiomas are also compressible, and So like coughing or gravity is applied, the contents are displaced from the cavity into the cavity from where they have come out. And so but in case of the former, the contents are not actually displaced, and swelling immediately reappears, and as soon as the pressure is taken off, and the pulsatility. So this reappearance is not taken into account usually, but in most cases it is very important to see about the compressibility, and in case of surgery. And so because the skin may be very much loose, and so you need to tighten the skin also, and you have pulsatility. So you have expansile pulsation, transmitted pulsation, and telangiectatic sarcoma. So swelling is very vascular one. So swelling arises from artery close to an artery, and so as we saw earlier, and if the swelling is very vascular one, it is a telangiectatic sarcoma. And so then you have demonstration whether the pulsation is expansile or transmitted in nature, and then you have some diagrams, diagnostic representation of expansile and transmitted pulsation, and is an aneurysm, and A is an artery, and T is a tumor. So um, then you have all of the things, and you have expansile one, transmitted one. Patient is placed in knee elbow position, tumor lying in front of the abdominal aorta, and fixity to the skin. So that is malignant infiltration. Example is epithelioma. Relation to surrounding structures. That is subcutaneous tissue are free from the overlying skin and from underlying contracted muscle. And so if the underlying muscle is made taut, the tumor cannot be removed if it is fixed to the muscle. And so relation to the surrounding structures arising from deep fascia, arising from muscle, that is movement against resistance, and all of the things. So there are figures showing how to make a muscle taut by putting it into contraction against resistance. So trapezius, biceps brachii, latissimus dorsi, triceps, flexors of the wrist, extensors of the wrist, pectoralis major. So figure showing how to make a muscle taut by putting it into contraction against resistance. Quadriceps femoris, hamstring, gluteus maximus, adductors of the thigh, gluteus medius, extensors of the ankle, and all of the things. So and the flexors of the ankle. And so um, like some dance theory it is. So shows how the swelling in connection with tendon moves along with the tendon. Rupture of long tendon of the biceps, and um, and so state of the regional lymph nodes, and so you must exclude generalized lymphadenopathy and percussion. So presence of a gaseous content within the swelling, that is a resonant note over a hernia, or to elicit slight tenderness, that is a Brody's abscess. And hydatid thrill is a special sign in case of a hydatid cyst. So this is very interesting, I think. In the index, middle, and ring finger on the left hand are placed on the surface of swelling, so that the middle finger rests on the dome of the swelling, and other two fingers are placed as far apart as size of swelling will permit. The right middle finger is used to percuss on the left middle finger, and the sensation of thrill is felt by other two fingers. This is due to displacement of the daughter cyst in the fluid of this mother cyst and then strike back the wall of mother cyst to produce the typical hydatid thrill. So such a never heard story, but it's real. And so auscultation for an machinery murmur and an extensive cystoid aneurysm. So, and there is a diagram given. So cystoid aneurysm is something in the forehead, I think. So, like then you have auscultations for any bruits or murmurs, and the machinery murmur, and the measurement, that is any wasting distal to the swelling, um, and increase in swelling in different intervals, and movements. So, like so the author is saying about Kishkinda, I think. And so there's a theme park, and author is very much interested, and examination for a pressure effect, and cause wasting paralysis, and um so like seen in aneurysm and dermoid cyst. So then you have the general examination. So and so like we give in case of malignant swelling and all of the things. So about the site of metastasis, cough, hemoptysis, pain in the chest for pulmonary metastasis, and for the presence of consolidation and pleural effusion, and um, to exclude the possibility of peritoneal metastasis, and spine, pelvis, trochanter of femur, skull should be examined to exclude bony metastasis, and so like other syphilitic stigmas, and if a swelling is suspected to be a gamma or a condyloma, and in case of a lymph node enlargement, so one should examine the other group of lymph nodes to find out the cause of lymphoglandular enlargement. And for special investigations, so TC, DC, ESR, and hemoglobin, which shows leukocytosis and anemia and all of the things, and an urine, and aspiration, FNAB, fine needle aspiration biopsy, and cytologies, and Papa-Nicolas technique, and exfoliative cytology, and in case of GI tumors, respiratory tract tumors, and urinary bladder, sputum or through endoscope, and female genital tract, and X-ray. So like in case of bony swelling, and so find out subjacent bone has been eroded by an aneurysm or a dermoid cyst. So then you have chest X-ray. It should be taken when pulmonary metastasis is to be excluded in case of malignant growth, and you have skin test, so tuberculin test, so tuberculin lesion, um, Cassony's test become positive in case of hydatid cyst, but negative result cannot exclude hydatid cyst. So, and you have ultrasonography. So, television monitor as an electronic representation of returning echoes, and so A mode scan, and echo intensity along the line of tissue examined in 2-dimension or B mode scan, and So like using a transducer, transverse longitudinal oblique direction, and you have and like and ionizing radiation is not used and safe for pregnant women and children. So it's used to determine the mass is solid or cystic, and so usually if it is cystic, it will have a fluid inside. So you can find it out with the needle itself, and so and computer tomography and different radiographic densities through cross-sectional volume of the tissues, and so in thin tomographic sections through a ring of tubes and detectors and all of the things, and so in case of collapse, fracture of vertebrae, so the AP and lateral views of CT scan is shown, and a three-dimensional CT scan and magnetic resonance imaging. So with diagnostic armamentarium and radio waves emitted by the protons and radio frequency pulses, and this is one of the oldest method licensed by new, so which forms the previous father of all of the present methods, and use a contrast medium for magnetic resonance tomography, and it's known as magnavist, and so must obtain with the plain scan and the bolus injection and contrast enhanced, that is zero point 0.2 ml magnavist per kg body weight is sufficient for good obesification. So like diagrams of MRI are shown there, and the first year I was asked to present on MRI, so magnetic resonance imaging, so physiology doctor was there, so he assisted me, and so like but usually it was a new topic to me actually, but I presented it somewhat, and so after presenting all of the subjects which I done and I see MRI, then again comes to my mind, and so angiography and biopsy in suspected malignant tumors, then you have needle biopsy, and for the various organ swellings, so Wim Silverman needle for liver, Travenol true cut needle for prostate through the perineum, and you have drill biopsy, punch biopsy from big ulcer of stomach. So then open biopsy, that is incisional biopsy, and excision biopsy, and then you have diagnosis of the swelling. So skin, subcutaneous tissue, muscle, vessel, nerve, bone, whether it is congenital, traumatic, inflammatory, neoplastic, otherwise. And so congenital swelling are generally present since birth, hemangioma, cystic hygroma, meningocele. So then, but make their appearance later in life, branchiocist, dermoid cyst, thyroglossal cyst, and traumatic swelling develop immediately after trauma, hematoma, fracture with displacement, dislocation, and cavernous hemangioma on the face, and so inflammatory. Present with redness, rubor, pain, dolor, heat, callus, swelling, tumor, and impairment of function, that is functio laser. And so there's already been 1 hour, and so how many pages left? Actually, it has a lot of pages, and so I'm standing on 41, and it has pages till 60. So Then um, we'll continue in the next video. But okay, let us finish this. So it will take just 10 to 20 minutes. And to given to pain, redness, heat, and for few rapidly growing sarcomas. And so one should look for tenderness and brawny induration and edema, and presence of fluctuation means presence of pus, and which indicates swelling is an inflammatory one. Related lymph node will be affected and will show signs of actual acute lymphadenitis, and so which is not an acute inflammation. And so leukocytosis is a constant feature, and chronic inflammation and swelling. So that is pain, redness, heat, and brawny induration and edema, and slight tenderness, rise of temperature, and all of the things. So then which never recedes, and neoplastic, it is swelling may be either benign or malignant, and benign tumors that grow slowly and encapsulated move freely, fibroadenoma of breast, better known as breast mouse. So hardly infiltrate the surrounding tissue and never metastasize either to the regional lymph nodes or to the distal organs. Then you have malignant tumors, and so pain is conspicuous but by its absence in malignant growths bearing osteosarcomas, and where pain precedes swelling, and so except osteosarcomas, because the pain precedes swelling, and so characteristics of benign and malignant growth. So like duration, pain, loss of weight, and loss of function is benign. That is slow growth and usually absence of pain. And malignant is rapid growth, usually seen above 40 years, but may occur at younger age, and may be painful at late stage, barring osteosarcoma, and which is painful from the beginning, and feature of malignant growth seen quite early. And the benign and malignant differentiations are given. So like I think we'll see it on the next video. Let me continue with the interesting facts of surgery, and thank you.